heart, you don't really need your legs, and you accept what's good. I mean, I'm thrilled that I don't have heart trouble. I'm thrilled that I don't have cancer. MS is just one of those burdens that are laid on you, and you fight it the best you can, but you don't let it get you down, because any neurologist will tell you that it's all in your head. So if you let it screw with your head, then you're defeated. So you just don't.
So I'm going to take a bunch of these and answer them as quickly as I can. How do you increase awareness among nursing students and medical students? I think with education is the critical point. The current crop of medical students are the most compassionate, humanistic that I've seen in my lifetime. So I think the future looks very bright. The question of how do you store cord blood? I think you need to talk to your pediatrician and your obstetrician, and they'll tell you there are places that you do that. It's not inexpensive. I'm 65. Do you think there'll be a cure found for my children's generation? Yes. Here is a question related to Iran, in which there has been a drastic increase in MS patients. The Iranians are Indo-Europeans. They have susceptibility genes that are not unlike the Northern Europeans. We are understanding much more about environment and genetics, and I think that quite clearly one would have to look at this closely, but this is, again, something which I think we are beginning to understand. The final point is the importance of early treatment for progressive MS, and how do we treat progressive MS? Well, there is no licensed treatment for progressive MS, but we try to study it and look carefully at what is happening to the patient in terms of new lesions, whether they are actually having attacks. We did a study on secondary progressive some years ago, and the entry criteria for that secondary progressive study was that you could not have a relapse. But once we started looking at these patients on a monthly basis, it turned out that about 3/4 of them were having relapses. So I think in that case, you could argue with the insurance companies, but we generally will treat those with the relapsing remitting agents, even though they're not licensed for that purpose.
Just quickly, somebody asked, I've gone off MS medications because none were working for me. I know Nancy does not take any medicines. Can you tell us what she does? When I was diagnosed, there was no medicines available, so I really had no choice. I took the homeopathic route. I still take tons of vitamins, and I never smoke, I never drink, I don't have salt. I try to be really positive and lead a healthy life, and it's working for me. If it wasn't working, of course, I would go on one of the medications. But for now, thank God, whatever I'm doing is working. And you definitely have to find out what's right for you. And MS is not one size fits all.
Okay. Question about genes and environment, factors leading to diagnosis. So a lot of epidemiologic studies have been done, but these clusters of MS that occur, it appears that they're random clusters. If you have 300 million people, you will find clusters. But when you control for having 300 million people in a particular country and study the clusters, they don't seem to be any more common than you would expect. There's a question about uveitis and multiple sclerosis and other autoimmune diseases. MS clusters with the other autoimmune diseases. About half of the MS genes we have identified are shared with other autoimmune diseases. Though there are differences, each of the autoimmune diseases have very different types of therapies. Question about Novantrone, why it isn't being used anymore. We believe that chemotherapy like cyclophosphamide and Novantrone do work, but the side effects of Novantrone, particularly cancers, were so high that we basically stopped using the drug. And let me just, in case I forget, read this. Happy birthday, Mom. We love you so much. Love, Isabella and Mariella. I love that.
So I'm being asked to attend to things that I've forgotten to mention or didn't emphasize enough, psychotherapy. So that's talk therapy. We know that medications work quicker. Talk therapy tends to last longer. The two together work better than either one alone. So if I was remiss in not including the fact that talk therapy, medications help greatly, but it doesn't explain why me, how do I adjust to life under these altered circumstances and the like. A number of questions sort of relate to the how do I feel about acupuncture and herbal remedies and these kinds of things. And let me tell you, what I tend to tell people is what we actually have as far as evidence-based medicine is about 30% of what you guys need to know. So the 70% of finding out what works best for you. So we'll give you the answers based on what the studies show, but you have to go out there. If acupuncture works and helps with the pain, by all means use it. And so you've got to talk to one another as well. A lot of these questions, I mean, I love this. This woman is, I am woman, hear me roar. It says, please reassure women that they don't have to choose between depression and orgasm or having a non-orgasmic future. So more power to you. And so it requires a lot of different medications. So thank you. Yes, keep trying. The goal. So, but by all means, talk to one another, because you'll find at these meetings, life's too short, cut to the chase, you need answers, and we don't have all the answers. So please, go out there and talk to one another. But yes, you don't have to commit to a non-orgasmic future. It's not that these medicines should make you into a different person. They should just return you to being the old person you were before the depression set in. So.
I have two things I want to say quickly. The first is that going back to training, the Race to Erase MS has been critical in the past few years to fund junior faculty. You heard we're all losing nerve cells on a yearly basis, but even on a daily basis after you pass the 20-year mark. And we're really proud of being able to train some of the great neurologists and researchers for working in MS. Second quick thing is two questions about vitamin here. What's the maximum level a person should take? We recommend that people should not take more than 5,000 units per day unless it's done under medical surveillance. So you need to check your levels on a regular basis if you take more than that, because you don't want to overdose. We think it may prevent inflammation, but trials are ongoing to actually answer these very questions. It's actually led by the Hopkins Center.
What type of regular exercise do you recommend? Something that you will do regularly. Everybody you should be exercising regularly. It's very important for people with MS to be exercising regularly. So if it's yoga that you'll do yoga. If it's Tai Chi that you'll do that. If it's swimming that you'll do that. Working out on an exercise bicycle, or if you've got limited use of your arms, these devices that exercise the upper extremities. Ideally, you'll be doing a form of exercise that is aerobic, because aerobic exercises stimulates the growth of new brain cells in the part of the brain dealing with memory. But the important thing is to do something and do it regularly, and do something you enjoy.
I have one question. We've been talking about MS and MS progression, and I have a question here: is how do we even diagnose MS? So we do have a definition. We have specific criteria. Your neurologist has to be aware of the definition of MS. It's at times challenging, I must admit, because it's a moving target. The definition we use is the definition that a consensus of doctors put together in 2010. And then before that, it was 2005. And before that, it was 2000. And I suspect that in a year from now or next year, the year after that, we're going to have another definition, another consensus. So it's very important that your neurologist is aware of the definition. Essentially, it comes down to have clinical symptoms that you experience as a patient, and we document signs on a neuro exam. And I must admit again, and although I have a bias, we have been using imaging, MRI imaging, a lot more than before, and we can potentially have the ability to diagnose MS earlier than 10 years ago or 15 years ago. So we are including MRI criteria in our definition of MS. So I do want to emphasize the importance of imaging, again, in the diagnosis of MS. So a combination of clinical symptoms, signs, and imaging features. When this is not very clear, we have to, at times, use spinal taps, or results from a spinal tap, to document specific proteins in the spinal fluid. We tend to use that less and less, I must say clinically, although it does give us a lot of important results. But clinical symptoms, signs, imaging, and at times we need a spinal tap. And we need to rule out other conditions that can mimic MS, vitamin B12 deficiency, for instance. So blood work is important to rule out other things. That's essentially where we stand.
We're going to conclude the panel, but the panel will be hanging around, some of them, so please feel free to come up and talk to all of us. And at this time, we're going to let Nancy do the conclusion.
Okay, I guess not. Thank you all, everybody on the panel, especially for being here and presenting all these amazing things. It's really amazing to be in this group. I'm learning a lot, obviously, as everybody else today. There's so much going on. We're so excited. There's so much hope and there's so much promise. MS is not one disease. It's different in so many people. And I think you have to really sort of weigh in what you're hearing today and see what is right for you and not just go with one thing. I thank everybody for being here today. I thank Dean Singleton for letting us honor him last night. Amazing. Again, happy birthday, Claudia. And Jack, thank you so much. And everybody. And also, if you have questions afterwards, you can ask some quick questions of the brilliant doctors. They're hard to get into, so this is really a great opportunity because none of them answer phone calls, and they're impossible, and they charge too much money. So anyway, this is a moment.
I would like, on the part of the investigators, to thank Nancy. It's really been inspirational to have been working with her and to listen to her and to have conversations about this disease. We're very lucky to have a person like this.
Thank you, everybody.